Hi friends, I am Dr.Swapna Chekuri from Hyderabad Women and Fertility Centre. Welcome to my channel. So today let us discuss all about preterm labor. So when a lady delivers before 37 completed weeks of gestation, we consider it as a preterm delivery. So what are the risk factors for a preterm delivery? Who are the individuals who are at risk for preterm? So individuals who are carrying twins, or if the patient is having polyhydramnios, excess of amniotic fluid, then also they are at increased risk of preterm deliveries. And history of cervical incompetence, and history of previous preterm births, then history of recurrent vaginal infections or a recurrent urinary tract infections can lead to preterm labor. Because what happens with recurrent vaginal infections, the amniotic membranes, the strength of the amniotic membranes becomes weak, and that's when the patients land up with preterm labor. So these are all the risk factors associated with the preterm delivery. And what are the symptoms of preterm delivery? How the patient experience the symptoms? So coming to the first point, usually the ladies will have recurrent infections. Apart from that, they might have uterine contractions on and off, and they'll have this pelvic pressure as though the baby is dropping down. So and then simultaneously they'll have vague discomfort in the lower abdomen. They can have low back ache. Along with that, they'll have dragging sensation in the thighs as well. So these are all the symptoms of preterm labor. Few individuals will have nausea, vomiting sensation, and few of the individuals they'll have diarrhea. Repeatedly they'll be emptying the bladder and bowel repeatedly. And then some individuals might have light bleeding or even spotting as well. So these are all the symptoms associated with preterm labor. And what are the prevention, like what's the treatment part? So coming to if at all, if the patient is having a recurrent vaginal infections or urinary tract infections, that has to be treated with antibiotics, appropriate antibiotics. And then if the lady is experiencing severe dragging pain, we need to rule out urinary tract infection as well, because both of them mimic the same. The symptoms are same with preterm labor as well as with urinary tract infection. So whenever you experience these symptoms, immediately you need to consult a doctor. So and then a patient with a previous history of cervical incompetence will put the cervical stage. Patient with a fibroid, we usually advise for fibroid removal even before planning for a pregnancy. And in case if she gets pregnant while the fibroid is inside the uterus only, then that's when we give them tocolytics to keep the uterus relaxed, and we give them progesterone supports as well. And these are all the treatment and supportive medication which we usually give to the patient with a history of preterm labor. So friends, in this video we discussed what is preterm labor and who are at risk of preterm delivery, and what are the symptoms associated with that, and what are the preventive precautions to be taken. So if you find the video is good, if you find it's informative, please like my video and share with your friends and needy people. Thank you.